Hello and welcome. So the article that we're going to be talking about today is called Clinical Potential of Hemodynamic Ramp Test by Simultaneous Echocardiography and Right Heart Catheterization for Aortic Insufficiency in a patient with continuous flow left ventricular assist device. So here, what this article is talking about. So here we have some patients who have left ventricular assist device, which pumps blood from the left ventricle to the aorta. But unfortunately, sometimes this is associated with aortic regurg, which is problematic. So the researchers in this article is trying to design a way to determine if there is an underlying aortic regurg in these patients. So they are designing a test. Um, this test is called hemodynamic test by symptomatic echocardiography and right heart catheterization. This is the name of the test. And this test is based upon three elements. So the first element is right heart catheterization, and it's gonna give us pulmonary capillary wedge pressure reading and the cardiac output reading. The second element is the echocardiography, which is gonna give us the left ventricular and diastolic dimension. And the third element is the ventricular assist device flow. So normally in healthy individuals, which is gonna have the negative test, increasing the ventricular assist device flow is going to lead to an increase in cardiac output. And it's also going to lead to a decrease in left ventricular and diastolic dimension. And it's also going to lead to a decrease in the pulmonary capillary wedge pressure. But in patients who have aortic regurg, blood is going to be shifted. Some of the blood is going to actually go from the device back to the left ventricle instead of going up. So this is may lead to a change in the test results. So increasing the ventricular assist device flow in these patients is not gonna lead to an increase in the cardiac output, and it's not going to lead to an increase in the left ventricular and diastolic dimension, and it's not going to lead to a decrease in the pulmonary capillary wedge pressure. So that concludes a negative test for these patients, and it tells the physicians that they may need to act in a surgical fashion to example, to perform an aortic valve repair surgery or something like that. Thank you so much for watching.